Well, I feel this clinic help a lot of people, especially because dental work is expensive. I feel like it's a big impact on the community.
Hands-on experience is definitely the biggest thing in dental hygiene. It's literally all we do.
I sure hope that I'm making a difference in students' life. I want to be there for the students that are just embarking on the journey that I started.
It was my professors that inspired me to come back and teach, and it's the students that keep me here.
Good evening, Pikes State Dental Center. This is Peggy. How can I help you?
My name is Cindy Dominguez. I've been here on Pikes for 2 years and a half. I was finishing my associate as a dental assistant. When I was little, I dreamed with this, you know. In Mexico, it's a little different. I don't know that life is gonna bring me here after. I always like it. I like to do this.
Okay, let me get everything ready for Doc so he can come and numb you.
My name is Eva Pasorski and I'm the Dental Center Director here at Pikes Peak State College. I've been in education for the past 14 years and the last couple years in administration. Here at Pikes Peak State College, we have two dental programs. We have the dental assisting program and the dental hygiene program. So dental assisting trains students to be the auxiliary in a dental setting. So they're responsible for more preparing the rooms, preparing the patients for procedures, and assisting in the different procedures with the dentist present. And the dental hygiene students are learning to treat patients, is responsible for preventing and treating periodontal disease or gum disease. So they can treat patients from the little munchkins, little kids, all the way to adults and complex patients.
So did you notice on the bridge one, if you look at it, you've got 2 crowns and a what? What's that called? These are abutment teeth. This is the...
Is that the PU?
Starts with a P, Pontic.
Yeah. Hands-on experience is definitely the biggest thing in dental hygiene. It's literally all we do. Being in clinic and getting hands-on experience with every single patient I've seen has definitely been so helpful, especially because everybody's different. Everybody is going to have a different reaction to certain things. So I guess it's really essential to practice and practice as much as possible.
The reason it's important is because the students, when they graduate and they take on jobs in the community, they have to be able to perform very specific skills. Hence, when they're in school, they get time to practice, like in the dental hygiene program. They're practicing first on the dummies that we have here, then they practice on each other, and then they move on to practicing on patients, on live patients. So by the time the students graduate, they actually have a vast experience with different kinds of patients.
There's a lot of challenges for me. The first one is the language. Like, as you can see, I come here speaking any English, like at all. Sometimes when I'm reading, when I'm studying, obviously it's not my first language, so I have to do it like multiple times, redo and redo and redo, so I can learn what I want to learn. That's one of the biggest challenges that I have.
Oh, this isn't even open. So for mandibular arches, you use 2 scoops. For maxillary arches, you use 3. 2 scoops. You get it wet so that the powder doesn't go all over everywhere. You see how creamy that's getting to be? Gather it up. Put it in the tray. And you come over here and wait for it to set up. Make sense? So, next year you guys get to do this on each other. Huh? Yeah.
Several times.
My name is Amy Reed, and I teach dental assisting here at Pikes Peak State College. I am also the dental assisting department chair. I've been at this institution for 37 years now. The technology that we have here at Pikes Peak State College is very rare when it comes to dental education. We are the only facility of its kind in the state of Colorado and one of a handful in the nation that use simulation technology to videotape students while they're doing their skills so that they can see playback of their performance and be able to correct mistakes that they need to make, or they can continue on and say, well, I'm really good at that, and gain confidence from it.
This new place is amazing for learn about everything on dental. They have a lot of technology that even most of the offices didn't have. My first year, I was on the other school, on the old school, and there is nothing to do with this clinic. Like, this is super nice. You learn the most, and you're super prepared for the offices outside. This is pretty amazing. The teachers are really good. They help you a lot.
I was motivated to become a teacher in dental assisting after I came to Pikes Peak State College. I attended here as a student, and then I was able to go out and become a dental assistant and work in the profession with some very amazing dental teams. And we would host students in our offices in internship, and I was always interested in seeing what they knew and how I could help them hone their skills a little bit better. And when I had the opportunity to come back and teach, I thought how amazing it would be to share my knowledge and my skills with students to help them become better dental assistants. And so it was my professors actually that inspired me to come back and teach, and it's the students that keep me here.
Do you feel like you're making a difference in students' lives?
I sure hope that I'm making a difference in students' life. I want to especially be there for the students that are just embarking on the journey that I started. I was a first-generation college student. I had to support myself all through high school and college, which a lot of students do. I think by representing that population, I'm able to connect with the students by showing that even if you start by working through school and going through school, you can go further and you can get more education and more training, and eventually, really, sky is the limit.
I feel like I'm making a difference in student lives because I have students that come back and tell me, do you remember that time when you told me I was going to be a great dental assistant? And so I had a student that came back and said that, and I said, yeah, I remember that. I said it because it was the truth. And she said, well, that inspired me to go on. That inspired me to continue because I was not feeling really well about my skills at that point in time. And you told me I could do it, and I believed you. And now I can, and now look at me where I am. I'm a lead dental assistant, and I'm doing well, and I love my profession. And when I get to hear feedback from students like that, that motivates me to continue on and do more and more. The reason that we offer dental services to the public is helping the community to better health care, and many times it's for people that wouldn't otherwise be able to access that care. And because we don't charge a lot of money for patient care here at the clinic. We don't do dentistry for people just to do dentistry on them. We do dentistry for people because they're in need of better oral health. We don't just look at a tooth and say, oh, let's do a filling here. If it really needs a filling because it has decay, then we'll do it. If it doesn't need a filling, then we're not going to do that. And we can counsel the community and help them learn better oral care by saying, oh, well, these teeth don't need it, but these teeth do need some care because of, and let's take a look at what you're doing at home to maintain this, and how can we make this easier. You have a filling here that's been broken down for a couple years now. Oh, we see that it's trapping food for you. Let's see that we can fix it and make it better.
I've been to this clinic, I think this is my 3rd visit. The first 2 visits were like just a routine checkup and then a dental exam to see what's going on in my mouth. Yeah. I'm a student here, so they showed us outlets that Pikes Peak offers, and this really, hit home with it, honestly. Low-cost dental, I had a root canal a while ago that didn't, do too well for me after a year, and so they offered to help me. The experience here has been great. They're really helpful with like my schedule, and they've just been super helpful. They call me when there's a schedule change and I can get in, and it's super lenient and helpful with that, and it's great. Low-cost care means a lot. Being a student, a lot of out-of-pocket expenses, a ton of those, as well as having to quit my employment leading up to all my clinicals and everything, just because you just can't have a full-time job and be a full-time student, especially at a hospital for 8 to 12 hours a day. Now I'm in the nursing program, so it helps a lot.
And one of the students of the dental center just posted that she's trying to spread the word about the facility, the COVID benefit for the community. And I reached her and she gave me all the information that I need to know about how to save a lot of money, I will say, and it's a wonderful opportunity. Right now I feel like I have one provider, very trusting. I feel like everybody over here is trying to do from the heart the service that they offer. For me, it's discovery experience right now, is to try to understand how it works, everything around, even how the new different way to receive the services, because in the past with my old providers were not exactly like I receive over here, and I'm so happy. And this make more confidence that you will be treated among professionals.
What would I say to someone that cannot afford dental care? I would say that they can come here and they get most of the care, not all of it, but vast majority of the care for much discounted fees. We are also a Medicaid provider. For those patients that are on Medicaid, they can get the services here at the dental clinic. And beyond that, beyond getting access to care, which we can provide, I would say it is very, very important that you do get care, that you get regular checkups, because it's not only about the aesthetics of dentistry, dentistry is about health. So whatever is happening in the patient's mouth reflects what's going on in your overall health, overall body. The head is connected to the rest of the body, and a lot of the signs and symptoms of other diseases show up in the mouth first. It's really, really important that you seek care on a regular basis for overall health, not just dental health.
In one word, what does this clinic mean to you?
One word, wow. Gratitude, because I've lived an amazing life here at Pikes Peak State College. And all along the way, from the time I was a student until this very day, from my teachers, from my supervisors along the way, all I've ever received was love and acceptance and encouragement. And so gratitude for this facility to allow me to become a person who makes a difference in the world.
I've been here for a lot of time, like the people that I've been meeting here, that I've known here, the patients, my classmates, I love all of them. We spend a lot of time in here together. I feel like I'm gonna miss this place.
To the students, I would say if you're going to go into the dental profession, whether it's as an assistant, a hygienist, a dental therapist, a dentist. Do it with conviction. Do it that you can muster. Seek out education. Once you graduate, continue to seek out education. Continue to reach forward. Continue to improve your skills. Because once you leave college, your journey's just beginning. And your quest for knowledge should not stop. So start with us. Let us give you a hunger for knowledge and skill, and go out and change the world.